Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Lee Connor of Hamilton Healthcare System and Hamilton Physician Group Specialty Care in Dalton, Georgia. Thank you for joining us today, Dr. Connor.
Thank you so much for having me.
I'm glad you're here. Dr. Connor is a board-certified infectious disease specialist. He completed his medical training at Florida International University, Herbert Wertheim College in Miami-Dade County, Florida, and his residency and fellowship at Wake Forest University School of Medicine, Winston-Salem, North Carolina. He practices at Hamilton Medical Center and Hamilton Physician Group Specialty Care down the street from Hamilton Medical Center. Hamilton Physician Group Specialty Care houses several physician specialties, including infectious disease, pulmonology, and rheumatology. Great to see you today, Dr. Connor.
Thanks for having me again.
I'm glad you came by. Today we're going to talk about staph infections and MRSA. Tell us more about what these things are. What is a staph infection? Then tell us what MRSA is.
Yeah. Staph infections, us infectious disease folks have a great respect for this pathogen in particular. It's can be very devastating. And so this is a very common skin bacteria that, is on people's skin. It can be up the nose too. That's sort of where it resides. And so it's on our bodies and really, it doesn't cause us a problem until it gets into a deeper space. If we get a cut that's infected, gets into our bloodstream, we have wounds. So it can be a pretty nasty bacteria. And
a staph infection.
A staph infection. And then when we talk about staph, MRSA is probably the one that people talk the most about. And MRSA is just an acronym for methicillin-resistant Staph aureus. So that first part just means it's resistant to a lot of our really great antibiotics. And so we have to go to different antibiotics that would particularly treat that brand of staph.
Oh, well, are you coming up with the new antibiotics all the time?
There's a lot of push from the government and the CDC and research funding to really bring new antibiotics to market so that we do have options there are bacteria out there that have no great options really.
Well, I go to the pharmacy. I found out that antibiotics are very inexpensive, very inexpensive. And then I hear talk of sometimes doctors will give an antibiotic when they don't need to. It's overprescribed. Mm-hmm. Yep. Do you hear of that sometimes?
Oh yeah, that's a big part of what I kind of do. It's part of my job, and the fancy word for it is antimicrobial stewardship. So we got to be really good stewards of the antibiotics that we do have because there's only a finite amount of them.
And you don't want to get resistant to them, right?
Exactly. So the more that we expose individuals or community to an antibiotic, the more we see the bacteria become wise to that antibiotic or resistant, where they found out a way to work around that particular drug. And then, we've lost that.
Even though these microbes, it is something how that they can learn and go around what we have.
Yep.
When they're not really alive. Well, they're alive, but they don't have a mind. They don't
they're not
think.
Intelligent. Yeah.
Yes. I don't know how that works. That is just fascinating.
Yep. Bacteria like to share genetic code. There's things called transposons and,
But they figure out a way around what we have.
And they share that information between each other. So different bacteria can show other bacteria.
And then here we go.
Yeah, and then we have to, use other drugs that may be more toxic or not as good as the old ones. So it's a challenge and overprescription. When you're treating a viral infection with antibiotics, it's not ideal, and really you're exposing that person to risks, and you're exposing the community to a potentially more resistant, flora.
Well, while we're talking about risk, who do you think is the most at risk for a staph infection?
Anybody can get a staph infection from, an infected cut or a wound, any little thing. But the people that really tend to get ill are, the more immunocompromised folks, so older folks, people with diabetes. But yeah, it can affect anybody. I mean, it doesn't matter how healthy you are. If you get a break in the skin and unlucky enough to have that take hold, you can be pretty sick.
Pretty quickly,
yeah. Staph is probably one of the most aggressive bacteria that we deal with, and it moves quickly, and it causes significant mortality.
Wow. MRSA, how is MRSA spread?
So when we talk about staph, MRSA is the resistant kind. There's MSSA, which is the sensitive kind, and that kind of depends on, what antibiotics you're going to give. But, they're on our skin, and they're potentially, it can be from skin-to-skin contact. So
it's on everyone's skin all the time? I have it on my skin now. You have it on your skin?
Oh, yeah. So staph is, prevalent on our skin. Some people have MSSA. Some people have MRSA. But, And so when we do find someone with MRSA and in the hospital, we wear our gowns and stuff so that we don't transmit that from patient to patient, because it is really that touching of, body surfaces, fomites, which is like, inanimate objects like clothing and doorknobs and stuff like that kind of act as vectors. So yeah, close contact, that's sort of how we can spread MRSA inadvertently.
Now, an MRSA skin infection, have you seen that? What does that look like?
Yeah, so most of the time when we're talking about that, it's going to be something that makes pus, so it's going to have some purulence to it. Usually forms abscesses, and it gets red, angry, super painful, and then you can kind of see that pus building beneath it. And probably people have had family members, or if not themselves, develop something like that where it needs someone to cut into it, drain it, and good wound care and antibiotics to kind of get that eradicated before it goes any deeper. And a lot of these skin infections start off as that, and then people let them go, don't seek treatment, and it just starts to fester. And then if it gets into the bloodstream, then you get to meet me at the hospital because I'm the one that's going to be managing that. Just because it is so deadly when it gets into your bloodstream, is that you really want an ID provider to be there to take care of you. But, that really speaks to just if you have something like that, early treatment, we can get away with pills, maybe a little bit of drainage in the office, and get you back in good shape before
you take maybe a shot of an antibiotic?
Yeah, sometimes they'll do that in the clinics, yeah, or pills. There's a few good staph drugs that, are well tolerated, and we can give you in the outpatient setting. And if we get there early enough, like almost a lot of things in medicine, earlier the better. Trying to do damage control later down the line, it complicates things.
Medicine has come such a long way.
Yep. And if you get MRSA or any staph really in the blood, then we're talking about IV antibiotics for a very long period of time. And so
you'll be in the hospital for that?
You'll be there for probably a week or so, depending on how well you do. And then we'll be talking about antibiotics when you leave. And sometimes that requires IV antibiotics for 4 or 6 weeks, depending on how bad it is.
I see. Well, now we've been talking about how you treat it, and we've been talking about what it is. But give me some idea of preventing a staph infection.
Yep. So, basically good hand hygiene is paramount in this. We were talking about contact surfaces and person-to-person contact as being a good way to transmit MRSA. But washing your hands is one part. The other part is if you do end up getting a cut, a wound, you really want to be good about washing that out immediately, keeping it covered, clean. If it has any signs that worries you, like redness or it's draining a lot of fluid or super tender, definitely reaching out to your primary care doc or going to one of the convenient cares and getting that addressed right away. Those would be the best ways of really kind of heading off any trouble in terms of staph infections or any other bacterial infection that can really get in there and run rampant.
Well, in life, we all get a scratch or, a little puncture wound of some kind, and Neosporin or Bactine, those kind of things, putting a Band-Aid on it, that is a good thing.
Yeah, those can help. And, good old-fashioned soap and water. It might not feel great when you're doing it, but really getting that soap in there and washing out any debris, any foreign material, and then that soap is going to wash away a lot of those bacteria too. And so that just gives your body, less to fight off. You'll be able to close that wound up nice. Good old-fashioned soap and water, and then you can bandage it, Neosporin or mupirocin, those sort of things.
And then be on our way.
Yeah, exactly. And the patients, like we were saying, who are high risk, diabetics, when diabetes has attacked a lot of the, peripheral stuff, like your feet, that's the one thing they always tell you to look out for. Boy, these diabetic wounds, staph loves to infect these, a bunch of other bacteria too. But, it's just super important to be aware, in our diabetics and our immunocompromised of anything, keeping an eye on, any breaks in the skin could potentially, get infected. And so, those people I'd really caution to, go see your podiatrist, really keep an eye on it, get that mirror out and check your feet for anything, since sometimes they don't have great feeling in their feet and you can't know. Sometimes you have to have amputation, but hopefully early antibiotics, getting it taken care of with the wound care, good controlled diabetes to hopefully prevent a lot of that, stuff too. Those are all super important. But yeah, people get new shoes and don't realize they don't fit right, and they rub ulcers and they just break open, get infected. And really by the time, if you're not looking, by the time you notice, it's already worked itself in. And another aspect of what I do is the treatment of bone infections, and probably the most common place we see that is in the feet. And that's when the bacteria, work through the soft tissue, destroy a lot of, healthy tissue there, and then work their way into the bone. And then when we're at that point, we're talking about 6 weeks of antibiotics to really clear it out of the bone. So, you can really try your best But once it takes a foothold there, sometimes the only option is amputation.
And it all started with a staph infection.
Yeah, that's probably number one up there. I would say.
How about that?
Yep, it's prevalent, and it takes one little cut.
Dr. Connor, it's always great to have you on the show. Thank you so much. I appreciate you joining us today.
Absolutely. Thank you for having me.
For more information or an appointment at Hamilton Physician Group Specialty Care, call 706-529-3072 or visit hamiltonhealth.com/specialty care. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.